Did you know that tuberculosis can affect nearly all the organs of our body? I am Dr. Vivek Nangia, Vice Chairman and Head, Institute of Pulmonary Critical Care and Sleep Disorders at Max Hospital, Saket. Tuberculosis is a common disease in our country. While lungs are most commonly affected and are the most common source of spreading the infection also, but then TB can affect nearly all organs of our body except for hair and nails. If I was to start, they could affect your brain, where it is called neurotuberculosis. It could go into the eyes, it could go into the nose, throat, in the tonsils. It is again very common. Then glands here in the neck are one of the most common sites, which are called lymph node tuberculosis. It can affect the entire skin. Lymph nodes could be there in the abdomen as well. It could affect the liver, spleen, kidneys, genitourinary tract, GI tract, heart, the layer around the heart, which is called pericardium. So when we are suspecting tuberculosis of any of these organs, of course, diagnosis becomes a little tricky because it's not easy to access all these sites so easily. So we depend on various kinds of tests like Mantoux, IGRA. We even sometimes have to go on to get a PET scan done to understand the spread of the disease and take biopsies and tissues from wherever it is possible. We always want to have a tissue diagnosis these days, primarily because it's an era of drug-resistant TB also. But the best part is tuberculosis is curable and curable to 100%. The treatment regimes are standardized all across the globe. So you don't need to reinvent them. You may need to adjust them according to the patient's needs and according to the patient's tolerance, but the treatment is very, very effective. So beware, any symptom, please consult your physician anytime.